Hello everyone and welcome back to our channel. So let us continue with the female reproductive system. So in this particular video we shall consider the pregnancy. So we shall see what are the different stages and what are the different events which are taking place as the embryo and the fetus is growing in the uterus. Okay, so before going into the actual development stages, let us consider the developmental biology, which is the study of the sequences of all these events which are taking place. Okay, so it is the study of sequence of the events from the fertilization. We have seen the development of the secondary oocyte. So if the sperm cells are present in the ampulla of the uterine tubes, the fertilization of the secondary oocyte may take place. So once fertilization takes place, it will start dividing. The nuclear material will fuse and it will start dividing. The cells will start dividing. It will form a zygote which will be converted into a blastocyte and it will be implanted into the uterus. Okay, so all these sequence of events, right from the fertilization of the secondary oocyte by a sperm cell to the formation of an adult organism, these are studied under the developmental biology. Now what is pregnancy? What is the meaning of pregnancy? So this pregnancy, it includes the sequence of events which begins with the fertilization. Okay, so once the fertilization takes place, it may proceed to implantation. So the attachment of this fertilized oocyte, okay, which has started dividing, so it will get implanted or it will get attached to the wall of the uterus. Okay, further embryonic development. Okay, so once the implantation takes place, the embryo will further develop. So we'll discuss about the embryonic development as well as the further fetal development. So later on it is known as a fetus. Okay, initially it's called as an embryo. Okay, so we'll see what are the different characteristic developmental stages which are occurring during the embryonic life and the fetal life. Okay, so usually this pregnancy, it lasts for about 38 weeks. Okay, mostly it is 38 weeks or sometimes 40 weeks after the last menstrual period. Okay, so we have seen in the female reproductive cycle, the menstruation takes place. So after that ovulation occurs, and if the sperm cells are present, it will fertilize the ovum, right? Okay, so pregnancy will occur which will last for around about 38 weeks. Okay, so during which the embryo and further the fetal development will take place. Okay, so this to do with the definition of the pregnancy. Then coming to obstetrics. Okay, obstetrics, this particular term, it was derived from the word obstetrics, means midwife. So this obstetrics, it deals with the management of the pregnancy, the labor. Okay, labor means parturition or the childbirth, and the neonatal period. Okay, neonatal period, it is the first 28 days after the birth. Okay, so all these is included, right? The pregnancy, the entire pregnancy period, the childbirth and the neonatal period is taken care of by the obstetrics. Okay, then there is prenatal development, something called prenatal development. Pre means before and natal means birth. Okay, so this prenatal development, it indicates the time from fertilization up to the birth. Okay, and this entire period, okay, right from the fertilization of the secondary oocyte by the sperm up to the childbirth, okay, this period, it lasts for about 9 months. Okay, and this period is divided into 3 periods. Okay, so 3 periods which are consisting of 3 calendar months each. Okay, so these 9 months, these are divided into 3 different periods. Okay, each comprising of 3 months. Okay, so total it is a 9 months period. Okay, so this prenatal development, it is divided into 3 periods called as trimesters. Okay, because it comprises of 3 months each, right? So it is known as trimesters. So let us talk about these 3 trimesters. So the first trimester, so obviously it will be the first 3 months of the pregnancy. So this is the most critical stage of the development, because in this particular period the rudiments of all the major organ systems will start appearing. Okay, also during this particular stage, the developing organism, it is most vulnerable to the effects of the drugs, radiations and the microbes. So it may get affected, mostly the miscarriages which take place. Okay, that is a loss of the baby. So it may take place mostly during this particular period. So it's wise to avoid any kind of medication during, at least during the first trimester. Rather, it should be avoided throughout the pregnancy unless and until it is found to be safe. Okay, there are certain drugs which are teratogenic in nature. Okay, teratogenic substances are those which can affect the fetus which is growing in the mother's womb. Okay, so in some or the other way it will affect the baby. Either the growth of the baby may get affected, okay, so the organs might not develop appropriately, or sometimes the fetal death may also take place. Okay, so in that case that substance is said to be teratogenic. So such substances which are consumed by the mother which can affect the fetus, such substances are known as teratogenic, because anything in the maternal circulation, it can easily reach the baby which is growing in the uterus, right? Because the placental connection through the umbilical cord, it supplies all the nutrients, oxygen, everything required by the baby, it is supplied by the mother, right? So baby, it cannot generate its own nutrients, it is even dependent upon the mother for the oxygen, because the fetus does not breathe itself, right? So everything which is required by the baby, it is provided by the maternal circulation. So anything in the maternal circulation can easily affect the fetus. Of course, there is a blood placental barrier also which restricts the substances or drugs from reaching the baby, but it might get affected. It is most vulnerable stage. Okay, then the second trimester, it will be comprising of the 4th, 5th and the 6th month. So this particular period, it is characterized by nearly complete development of the organ system. Okay, so by the end of this stage, the fetus, it assumes distinctively human features. So it will have a human-like appearance. Okay, then the last 3 months comprise of the 3rd trimester. This represents the period of rapid fetal growth. Okay, so the fetus will grow very rapidly during this particular period. So during this period, most of the organ systems become fully functional. Okay, so these are the 3 trimesters into which the pregnancy can be divided into. Okay, so as we have seen that there is something called embryonic period. Okay, so initially after the fertilization, it will grow as an embryo, right? So this period is known as the embryonic period. So it extends from the fertilization through the 8th week. Okay, so up to the 8th week of the development of the embryo, okay, this period is known as the embryonic period. Okay, so mostly here the various events will take place, like for example during the first week, usually it is characterized by several events like fertilization. So initially the fertilization will take place, then the cleavage of zygote, blastocyte formation, and implantation of this blastocyte will take place on the wall of the uterus. Okay, so further there are few more events which will take place. Yolk sac will get developed. Okay, budding of the limbs might take place during this particular stage. Okay, we'll come to the details of this embryonic period a little later. Then the later part is the fetal period. Okay, that is fetal period, which extends from the 9th week until the birth of the baby. So during this particular period, the tissues and the organs, okay, which are developed during the embryonic period, these will start to grow and differentiate. Okay, so here new structures, very few new structures will appear during the fetal period. Mostly the structures which are already formed during the embryonic period, these will start growing. Okay, so the rate of body growth, it is quite remarkable during this particular period, especially during the second half of the intrauterine life. Okay, that is after the 5th month. Okay, so rapid growth of the fetus will take place. Say for example, during the last 2.5 months of the intrauterine life, almost half of the full term weight is added. Okay, so till then the growth is little bit slow, but as the term completes during the last trimester, okay, the fetus grows very rapidly. Okay, so these are some of the characteristic features which are discussed over here, which will give you an idea about the rate with which the fetal development take place. So at the beginning of this fetal period, okay, that is during 9th month, the head of the fetus, it is about half the length of the body. So if you consider the entire length of the body of the fetus, okay, so the head, it occupies almost half the length of the full body. Okay, but by the end of the fetal period, the head size, it is only 1/4 the length of the body. Okay, so the body has grown now. Okay, because the head, it occupies how much? Initially it was half the length of the body, right? But now it is 1/4, okay, 1/4 of the length of the body. Okay, during the same period, the limbs, these also are increasing in size. So initially these are 1/8 the length of the body, but at the end it will become 1/2 of the fetal length. Okay, so you can see, imagine the rate with which the limbs, that is the hands and the legs, are growing of the fetus. Okay, now during this fetal period, the fetus is comparatively less vulnerable to any damaging effect. Okay, so it's in the first trimester usually that the embryo is more vulnerable to the effects of drugs, radiation and microbes we have seen. Okay, so but usually the fetus is less vulnerable to these effects as compared to the embryo. Okay, now let us go through the major changes which are taking place during the embryonic period and during the fetal period. Okay, so some of the representative changes are discussed over here. To discuss the development in detail would not be sufficient over here, because there are a lot of minute changes which are occurring, which is very difficult to discuss over here. But I think we shall discuss only the representative changes which are taking place through the different weeks of development. Okay, so as you can see that in the first column the time is represented, okay, in terms of weeks. The second column talks about the approximate size and the weight of the embryo or the fetus, and the last column discuss about the representative changes. Okay, so let us talk about the embryonic period. So from 1st to 4th week, the approximate size is 0.6 centimeters. It's just 0.6 centimeter. It is just 6 mm in size. Okay, now let us see what are the changes which are taking place. Okay, so in this period, the primary germ layers and notochord will develop. Okay, even a process called as neurulation will occur during this period. Okay, then the primary brain vesicles, somatis, and the intraembryonic coelom will develop during this period. Even the blood vessel formation, this will also begin, and the blood is formed in the yolk sac, allantois, and the chorion. Heart formation will also begin during this particular period, and it will start to beat even. Okay. Another change is that chorionic villi will develop, and placental formation will begin at this particular period, okay, through which the actual supply of the nutrients and the oxygen and the removal of the waste will take place. Okay. Then the embryo folds over itself, and the primitive gut, pharyngeal arches, and the limbs will bud during this particular period. Okay, so that is the hands and the feet will start budding out. Okay, and the eyes and ears, these also begin to develop. Tail is formed, and the body system begin to develop during this particular period. Okay, so these are the representative changes during the 1st to 4th week. Then coming to the next 4 weeks, that is the 5th to 8th week, the size is around about 3 centimeters and the weight is 1 gram. Okay, now in this particular period, the limbs, they become distinct, and digits also will start appearing during this period. The heart, it further develops to become 4 chambered. Okay, so 4 chambers, the heart comprises of 4 chambers, right? So they will develop during this phase. Eyes, these are far apart, and the eyelids are fused together. Nose also develops, but it is flatter. Face, it becomes more human-like. Okay, bones formation also will begin during this particular stage. Then the blood cells, these also start to be formed in the liver. Okay, and the external genitals, okay, of the male or the female, they will start begin to differentiating in this particular period. Tail disappears during these 4 weeks, and the major blood vessels will form, and many internal organs will continue to develop. So this is to do with the embryonic period. Then coming to the changes during the fetal period. So from 9th to 12th week, the size is around about 7.5 centimeter and the weight is 30 grams. Now let us see what are the changes which are taking place. So the head, it constitutes around about half of the length of the fetal body. That's what we have seen, right? So here during this period, the fetal length nearly doubles during this particular period. Brain will continue to enlarge. Face is little bit broad. Eyes, these are fully developed, but they are closed and widely separated. Okay, so these are wide apart. Okay, eyes do not gain their actual position. Nose, it develops a bridge. Okay, then the ears, these also start developing, but these are low set, not at the original position. Bone formation, which is started during the embryonic period, this will also continue. Then the upper limbs, they almost reach their final relative length to the length of the body. Okay, but the lower limbs, these are not quite well developed. Heartbeat can also be detected during this period. Then the gender, it can be easily distinguishable from the external genitals during this particular period. Okay, then the fetus also starts secreting the urine, which is added to the amniotic fluid, into which the baby floats. Okay, then the red bone marrow, thymus, spleen, they participate in the blood cell formation. Fetus also will start moving, but the movements are not yet felt by the mother. Okay, usually these are felt in the later stages. Okay, but the mother can feel that the baby is moving. Okay, further the body systems also continue to develop during these 4 weeks. And coming to the 13th to 16th week, it is round about 18 centimeter in length and 100 grams in weight. Now here head is relatively smaller than the rest of the body. Eyes, these were well apart, right? As we have seen, eyes, these are developed but closed and widely separated. Now they move medially to the final position. Even ears, which are low set, these also move to their final position on the sides of the head. The lower limbs which are not fully developed, these will start lengthening over here. Fetus, it will have more human-like appearance, okay? And rapid development of the body systems occur during this particular period. Then moving towards the 17 to 20 weeks, it is round about 25 to 30 centimeter in length and 200 to 450 grams in weight. Now here head is more proportionate to the rest of the body. Eyebrows and head hair, these are visible during this stage. Okay, now growth little bit slows down over here, okay, but the lower limbs, they continue to lengthen because these are not fully developed. Then the vernix caseosa, that is the fatty secretion of the oil glands and the dead epithelial cells will begin, and also lanugo, that is the delicate fetal hair, okay, these will cover the fetus. Okay. So brown fat is formed, okay, which will increase the heat production. Also the fetal movements, these are felt by the mother, that is quickening, that is known as. Okay. So now the mother can feel that the fetus is moving. Okay. Then coming to the 21st to 25th week, the length is 27 to 35 centimeter and the weight is 550 to 800 grams. So here the head becomes even more proportionate to the rest of the body. Weight gain, it is substantial. Skin, it is slightly pinkish in appearance, but it is wrinkled, it is not smooth. Okay. So the fetus is usually, which may be born at 24 weeks or older, these have the chance of survival if appropriate care is provided. Okay. So round about from the 6 months, almost the development of most of the body systems have taken place, so that even the premature birth, if at all it has taken place during this period, that is after the 24th week, that is the 6th month of the pregnancy, yet the fetus can survive. Okay, sometimes the delivery also takes place during the 7th month, yet the fetus can survive if appropriate care has been provided. Then the 26 to 29 weeks, the fetus is 32 to 42 centimeter in length and the weight is 1100 to 1350 grams. So here head and body, these are more proportionate. Eyes are open during this stage. Okay, and toenails are also visible during this stage. Now the body fat has started growing. Okay, so it is round about 3.5% of the total body mass, and additional subcutaneous fat, it smoothens out the wrinkles. We have seen that the skin is wrinkled, right? So some of the wrinkles are smoothened out due to the subcutaneous fat which is secreted. The testes, if it is a male baby, then the testes will start descending towards the scrotum. We have seen that the testes, they develop near the kidneys, and during the 28 to 32 weeks it will descend down into the scrotum. Okay. Further, the red bone marrow, okay, this is the major site for blood cell production now. Okay. Then sometimes the fetuses which are grown during this period, okay, they have greater chances of survival if intensive care is provided. Okay, because the lungs, if appropriate ventilation is provided, the lungs are quite functional and the baby can survive. Okay. Then from 30 to 34 weeks, the length is 41 to 45 centimeters and the weight is round about 2 kg to 2300 grams. Okay. Now here the skin, it is pink and smooth in appearance, and the fetus, it assumes the upside down position. Remember, the baby is positioned near the term in the last trimester. It is upside down. Okay, so the delivery, it takes place through the head, right? So the baby, when it is born, the head is pushed out first. Okay, so it assumes the upside down position. We have seen a picture wherein I have shown you the full term baby, okay, in the uterus, okay, how the position is. Okay, so it assumes the upside down position by now. Okay, till now it is able to move about. Okay, but now it occupies the upside down position. The body fat has also grown now. It is 8% of the total body mass. Okay. Then coming to the 35 to 38 weeks, okay, that is near term. The size is 50 centimeters in length and the weight is 3200 to 3400 grams. Okay. So by 38 weeks, okay, the circumference of the abdomen of the fetus, okay, it is greater than the circumference of the head. Okay. So now the baby is fully grown. The skin also has a bluish pink appearance, okay, and the growth will slow as the birth approaches. Now the baby is fully grown. Fat also, as you can see, that it is doubled. It is 16% of the total body mass. Testes, these have now reached the scrotum. It has descended down into the scrotum if it is a male infant. Okay, but even after the birth, the infant is not completely developed. We have seen that the development continues of all the systems, right, throughout the embryonic as well as the fetal period. But even after birth, that is the infantile period, during the infantile period, okay, that is the neonatal period, still the growth continues. It takes around about 1 year for the complete development of the nervous system. Okay, so it is not fully functional. Okay, even most of the metabolic processes are not fully developed in the infants or in the small babies. Okay, so it needs time for it to fully grow, which continues even after the birth. Okay, so these are some of the representative changes during the fetal period. So this is a representative picture how exactly the embryo and then the fetus will grow. Up to the 8th week is the embryo, right? So this is the 4th week embryo, this is the 8th week embryo, then 12-week fetus, this is the 16-week fetus, then 20 weeks, 24 weeks, 28 weeks, 32 weeks and the 36 weeks fetus. Okay, so this you can clearly differentiate the developmental stages through this particular picture. Okay, so I have some more pictures. Okay, this is a 20-day embryo. As you can see here, neural plate, neural groove has formed. Okay, somite has developed and there is a yolk sac which has developed over here. This is a 24-day embryo. Okay, as you can see, brain is developing, heart is developing, the spinal cord is also visible over here. Okay, this is a 32-day embryo. As you can see over here, lens placode, that is the eyes have started developing. Pharyngeal arches are also visible over here. Heart, it can be seen prominently, and these are the limbs which are budding out, right? Upper limbs, and these are the lower limbs, and the tail has formed. Okay, then this is a 44-day embryo. As you can see, the eyes have developed, nose has started develop, ear has started develop, limbs also have grown, right? Okay, and that's the umbilical cord. Then this is a 52-day-old embryo. As you can see, eyes can be clearly seen over here. This is a nose, these are the ears, but these are not at their original position. These are low set, right? Ears, eyes are also wide apart. But you can see upper limbs and lower limbs, these are growing. Okay, this is a 10-week fetus. Now it is a fetus, it's not an embryo now. Okay, after 9th week, it is a fetus now. As you can see, ears, eyes, nose, this can be clearly seen. Even the ribs are visible over here, right? That's the umbilical cord, and this is the placenta, the point of attachment of the umbilical cord to the uterine wall, and this is the yolk sac. Okay, and these are the limbs which can be clearly seen over here. Okay, so this is a 13-week fetus. As you can see, the organs have well developed now, right? Mouth also is visible, the fingers also are visible clearly over here. Okay, and this is a 26-week fetus. Okay, so it has mostly it has a human like appearance now. You can see the hair also which have grown over here. Okay, so this is to do with the pregnancy and the embryonic and the fetal developmental stages. Okay, so this is the reference for my presentation. Thank you for watching.